Yeah.
Smoking cigarettes, profoundly bad for executive function, cognition. Physical inactivity, sedentary behaviors, huge disease risk factors, but also profound impacts on executive function. Depression, chronic depression, untreated, not good for physical health, not good for brain health. And another factor we don't think about probably is low educational levels. Somebody that has very low educational levels and somebody that really has no interest in learning, that is linked with more physical health problems and brain-based problems.
Welcome back to the Managing Mental Health podcast. Join us as we talk to leading psychologists about all areas of mental health, and we hear from real people who have overcome real difficulties with mental health, who can now share hope and encouragement for us all. I'm Jamie, social psychologist, author, and trauma recovery coach. Welcome to part 3. This is our special 6-part series on executive functioning. If you're just now joining us, be sure to go back and check out parts 1 and 2, where we learned what executive functioning is, what it's responsible for, and some of the important clinical and forensic considerations. We also learned a little bit about things that can cause executive dysfunction, things like traumatic brain injuries, fetal drug exposure, childhood trauma, and neurological disorders, just to name a few. We're back today with our very special guest, Dr. Jerrod Brown. Dr. Brown, welcome back. Thank you for joining us.
Thank you, my friend. Thanks for having me.
Very good. Definitely a pleasure. So, last couple of episodes, we talked about the cognitive aspects of executive dysfunction, some of the emotional and behavioral considerations. But now you're telling me that this could also affect someone's physical health. How is that possible? How does that work?
Yeah, so when we think about executive function, think of it as like a higher order cognitive control center. So when that cognitive control center is doing what it's supposed to do, we're able to be more patient. We're able to pause and really think through our actions. So if you trickle that down into health and wellness and medical and physical health, when we're more mindful, when we're more planful, when we're more organized, what do you think we do? We might be more likely to exercise. We might be more likely to pause for a moment and think through, is that really a good idea to eat that piece of cake when I wake up at 2 a.m? Are we over consuming food when we go to the restaurant? So there's a case I consulted on several years ago, and this is an extreme example, but it was an adult gentleman, had a head injury, drug and alcohol problems, severe mental health challenges, all kinds of executive function impairments, had type 2 diabetes, was overweight, didn't take meds as prescribed. Every time he went to the buffet, he'd have 8 to 10 plates of food. That's no joke. So most people get filled up with one good sized plate at a buffet. So profound executive function impairment, along with other things, of course, help us not have that pause button and really think through, okay, if we have type 2 diabetes and we're having 3,000 calories in one meal and it's all sugar and sodium, that's not good for anybody. That's a profound example. Think of this too when we have really good executive function, when things are working properly, we have better self-control and self-regulation. So again, it's that inhibition. Inhibition is a component of executive function. Inhibition's our parking brake. When we have disinhibition, our parking brake's not working properly. So we learn that disinhibition is related to more anger control issues, substance misuse. But also disinhibition is related to maybe blowing off exercise, It could be a factor in obesity in some cases. It's definitely a factor to take into account with sleep. So, for example, maybe you are tired. You know you got to get to bed by 10 o'clock. You got to get up early the next day. Someone with profound disinhibition blows off the fact that I need to get a good night's sleep. I'd rather go online and look at movies, play games. And that's a component of self-control. So what happens? You're on games, you're watching movies through the night, you oversleep the next day, you wake up so groggy, you're not as effective as what you are. That is an aspect of
Mm-hmm.
disinhibition and self-control. Again, there's probably a million other factors at play here.
Mm-hmm.
But when we have really good self-control, self-regulation, the research says we live longer. I
Mm-hmm.
don't know where I saw the statistic, but I've given countless talks on self-regulation from different angles. And
Mm-hmm.
I've come across some statistics that say up to 40% of all deaths every year in the United States may be partially related to disinhibition, poor self-control, which is surprised to hear. But if you think about it, poor self-control, we overeat, we're more likely to use drugs. It
Mm-hmm.
could be a factor in road rage. It unfortunately is a variable in some cases of suicide. By no means am I saying that's the only factor. Suicide is
Mm-hmm.
driven by a million factors, but there is literature in the suicide research that says understand cognitive control, executive function is one piece of the puzzle.
Mm-hmm.
So, and there's interesting research too that I never thought about this until I really dug into this years ago. People with good self-control are more likely to use sunscreen in the sun so you protect your skin.
Mm-hmm.
Think about that. People with good self-control are more likely to brush their teeth regularly.
Mm-hmm.
I've consulted on cases not through an oral health lens, but it has come up where some of these clients never brush their teeth. There's a case I can remember. The adult woman didn't go to the dentist in 15 years. She had all kinds of dental health problems and
Mm-hmm.
just cavities, things like that. And people might ask yourself, well, how does that relate to all this? Well, poor dental health is related to brain health, gut health, heart
Mm-hmm.
health. There's literature on that. So
Mm-hmm.
having really good self-control,
Mm-hmm.
maybe another layer, not the only layer, that helps people get to their dentist regularly, helps people get a yearly physical. It just helps people take better care of themselves. So those are a few things. I'll go a lot deeper in the weeds in a minute, but just any thoughts, Jamie, you want, or anything you want me to go a little bit deeper into with that for your
Yeah.
audience?
So it sounds like this aspect that you're mentioning of the executive functioning has a lot to do with our ability to weigh future outcomes of our decisions. So what are we going to do that's beneficial, or what are we going to avoid that has negative implications? And if there's this executive dysfunction, a person might just not have the ability at that moment to think about future consequences, or to sometimes even remember, to do just normal, routine, healthy stuff.
Spot on. It really goes to the heart of delayed gratification. I don't want to exercise every single day or go for walks or eat tons and tons of vegetables. But I know if I do that, it's going to have a cumulative effect on my health in a good way. Maybe I
Mm-hmm.
don't see the benefit right away. Maybe you do right away. But if you do that day in and day out and form those good habits and practices,
Mm-hmm.
that adds up to a lifelong of benefits. And that really goes to the heart of neuroplasticity as well, which I know we're going to talk deeper about in this series. Doing those habits over and over and over again in a good way forms positive neuroplasticity.
Yep.
Doing those bad habits every single day. A bad habit could be maybe someone gets up and they start their day out by smoking a cigarette,
Mm-hmm.
having an energy drink,
Mm-hmm.
going through the drive-through and getting a cappuccino and a donut or whatever. those are things that can contribute to maladaptive neuroplasticity, which is not good. So just
Right.
really look at your habits you do.
Yeah.
Those are things that can be very helpful.
Yeah. I've noticed in my coaching practice, 99% of people I talk to and work with, that's one of the very first things that I kind of start mapping out for them or helping them map out is, okay, what are some of the bad habits and what are some of the good habits that we need to replace those with or add? And I've noticed that, especially with um, victims of trauma, people with ADHD, that there is that touch of executive dysfunction where the consequences of some of these behaviors, some of these just normal or regular behaviors, is just not quite there. But now, once you talk about it, it's like, oh yeah, yeah,
Mhm.
I see that, and then you can start that process of, okay, let's pick one or two and let's start working on those, and let's get those into the habit forming process. So yeah, I see that. I see that a lot. And it's interesting too that you mentioned, especially the statistic, or at least the concept, that a lot of disease, a lot of death, even early death, premature death, and illness that we see in our country could be related to that, because it kind of ties back to that first part, that it's those good behaviors that kind of prevent, and it's hard sometimes to say prevent the diseases, but the good behaviors are keeping your body healthy, keeping it in a place to where your immune system's better, your digestive system better, your heart, cardiovascular system's better, all those things. So that's I think, a very crucial point to make, that all those things are leading to longevity.
Think about this too. Maybe somebody starts out with a good habit, but they take that good habit to an extreme as well. So that good habit may become harmful in some cases as well.
Hmm.
On the flip side of that, maybe someone thinks they're doing a good habit, but it really is a bad habit. And I'll give a practical example of this. Maybe someone skips breakfast every single day, and
Hmm.
in their mind, they think that's going to help them lose weight.
Hmm.
If you look at the meal skipping literature, especially for breakfast, it's eye-opening. We should do
Hmm.
a recording on that sometime. And
Hmm.
people don't think about that. Meal skipping or breakfast, not good for brain and body health. But in that person's mind, maybe they read something online, or hey, this is really, really good, like
Hmm.
intermittent fasting. That's
Yep.
different. Intermittent fasting is probably pretty good. Talk to your nutritionist, dietitian about that, of course, but
Hmm.
that's a different ballgame. A good habit turning to a bad habit could be, maybe someone eats tons and tons of fruits and vegetables, and it gets to an obsession almost, where they have an over reliance on this. Here's one example that maybe we haven't thought of. I know somebody who changed their diet a long time ago, went from a Western diet to more of a healthy, non-processed diet.
Hmm.
They loaded up celery smoothies, they loaded up spinach smoothies every single day to the extreme. And they ended up getting kidney stones because of the high oxalate in
Oh.
that kind of food. You wouldn't think about that. So
Hmm.
there's so many layers here to think about.
Hmm.
Exercise to the extreme is not good. There's something called overtraining syndrome, where you can overtrain and exercise and hurt yourself. So I
Yeah.
think part of it too is moderation
Hmm.
and not taking a good thing to that extreme as well.
Yeah. They're definitely, I I think the best focus, or at least the best groundwork for us to lay in physical health and mental health, is a holistic, balanced approach. In other
Yeah.
words, taking the time to look at all the different aspects, whether it be exercise, diet, relationships, all those things, and saying, okay, what's the healthiest balance of this, and let me move in that direction. I'm a big football fan, so even you just talking about the over exercise, I can't tell you how many professional football players or wrestlers or people that are just nonstop training and tend to overdo it for 10, 15 years, and by the time they're 40, 45, they're already having knee surgeries, back surgeries. And if you quit training, then your body goes into like a deterioration mode, which, and that's a whole nother story on that. But yeah, I can see that. So this executive functioning idea then is that we might not have the ability to even recognize when we're not at a good balance, or when we're doing too much of anything.
On the extreme end of that, you'd want to be aware of that term we spoke about previously is abstract reasoning. So that is a component of executive function where somebody with good abstract reasoning can connect the dots, see the forest through the trees, plan for the future. Someone with very low abstract reasoning can't really understand how and why questions that well, can't really connect the dots that what I'm doing right now may not be good for my brain or body down the road. Like someone smoking cigarettes at the age of 14 or 15, in their mind, I'm going to live forever.
Mm-hmm.
That's going to catch up to you quite quickly.
Mm-hmm.
Someone that forgoes sleep. And this is very common in our society, but even more common probably in teenagers. And who hasn't done that? Pulling an all-nighter, staying up all night long. You do that day in and day out, that's going to come catching up to you very quickly. And there's some scary research what that can do to you long term as well. So abstract reasoning, self-control, inhibition, big topics. Another component of this that we probably don't think about enough, where it can have profound impacts on our physical health, is organizational deficits. If you know somebody that is completely disorganized, they lose things all the time. Maybe you go for a car ride with them and their car is just in disarray. You go to their house and their house is in disarray. Maybe it's school and your friend opens their locker and it's just completely disorganized and disarray. That's probably an executive function impairment on some level. And I've seen this play out with clients where that client is so disorganized, their brain is all over the map. What happens? Forget to take meds. You blow off appointments unintentionally because you're so disorganized. There's clutter everywhere. I can't find my paperwork to turn in my county paperwork to keep my health insurance going. And now you don't have health insurance. These are all things that can impact not only your emotional and behavioral health, but also your physical health. So organization and time management deficits are big things to consider here as well.
Yeah, that would be extremely important to not miss, doctor's appointments, taking your meds, things like that. Yeah. Okay, so a couple of questions. First one.
Yeah.
What do you think, or how do you see this in terms of the reciprocal consideration between, so executive functioning affecting physical health? Okay, what about physical health? Let's say there's an illness or an environmental issue, like food ingredients. That's been a big topic here in the U.S. And so if you've got a negative health problem in your body, that affecting executive functioning, because it seems like they both kind of play off of each other.
Definitely. I think I read you loud and clear. So untreated hypertension is a factor that can impact our cognitive health. So great thing to do, work with your doctor, get a handle on your blood pressure. High cholesterol, huge factor, not just for heart health, but for brain health. So somebody that deals with high cholesterol or imbalances in their cholesterol, another targeted area that's obviously great for our physical health, but equally important for our brain,
Mm,
our cognitive health. Obesity, big connection between obesity and executive dysfunction, and obesity. So they kind of go hand in hand.
mhm,
The topic of obesity is very complex. It's tricky. There's a lot of shame and stigma attached to it. By no means am I making it a simple thing.
mhm,
Because if you look at the obesity literature, it says genetic factors, environmental, food, diet, societal factors, just driving down the road, seeing billboards, your pop-ups on your computer. There's so many factors with obesity. But obesity is a chronic state of inflammation, the research says. So, and that chronic state of inflammation can impact executive function. And as I mentioned before, the client who went to the buffet who could not stop, he had profound executive function impairments. But also, I don't want to open up too much of a can of worms here, but hormonal imbalances,
mhm,
understanding the topics of ghrelin and leptin, which is a huge thing to be aware of with trauma literature.
mhm,
Ghrelin and leptin relate to like hunger hormones, and those hormones are important for us, for our brains to say, hey, we need to start eating when we're hungry, and our brains to say, stop, we're full. If those hormones are off, our brains may not tell us that we're full.
mm,
And it is something to consider in the childhood trauma literature. Why are many people with extensive childhood trauma histories overweight in adulthood? Not everybody, of course, is overweight with childhood trauma. But
mhm.
if you look at the adverse childhood experiences literature,
Yep.
there is a connection between that. Part of it is executive dysfunction. Part of it is ghrelin and leptin. Our brains aren't stopping when we're full.
Mm,
And again, there's a million other factors there as well. So
yeah.
smoking cigarettes, profoundly bad for executive function, cognition. Physical inactivity, sedentary behaviors, huge disease risk factors, but also profound impacts on executive function. Depression, chronic depression, untreated, not good for physical health,
Mm-mm.
not good for brain health. And another factor we don't think about probably is low educational levels. Somebody that has very low educational levels
Mhm,
and somebody that really has no interest in learning, that is linked with more physical health problems
mhm,
and brain-based problems. So treating depression, losing weight, eating healthier, managing our blood pressure, great for physical health, great for brain health. So that it's really
mm.
all interconnected.
Yeah, yeah, that's amazing. And I'm glad you mentioned the ACEs study because I was going to bring that up. That was what started that study in the first place was Dr. Felidi's. They were running the obesity program and having people lose weight, and then of course he started noticing that people would actually reach their goal, but then backslide, so to speak, go back and start putting on weight again drastically. And after several of these, he started thinking, wait a minute, there's a something else going on here. And then of course he went and looked at their childhood trauma. And I think it was like 55, 60%, something like that, had sexual abuse in childhood. And so there was a direct correlation, with the obesity there, and which was bringing on all the other health issues that they were experiencing. So, yeah, that's definitely uh, a major concern. To and I think this is true. I think we've at least hopefully started learning this lesson much better in healthcare, is that when there's a physical issue, that it's not just a physical symptom, that there's very likely something else behind the scenes, whether it be, childhood trauma, whether it be something with um, an executive functioning issue, maybe a neurological disorder or something like that. Which kind of leads us into my other question was, um, how can we do better as individuals? Let's say, I want to take better care of myself and have better executive functioning. What are some ways that or things I can do to have a positive impact on that?
Learn how to manage stress more effectively. Easier said than done, but I'll give you a reason why I'm saying that. Chronic stress, toxic stress has been linked with more negative emotionality, which could trigger more food cravings for sugar and fast food and all that stuff. So that could be a
Mm-hmm.
factor. It can impair disinhibition. It can lead to more disinhibition. So it erodes our brain's ability to, again, to slow down, pause, reflect, which basically
Mm-hmm.
increases more impulse control issues.
Mm-hmm.
It can contribute to more cognitive distortions. So like catastrophizing, black and white thinking, all or nothing thinking. And when our brains are under tons of stress, it really shuts down the problem solving
Mm-hmm.
aspect of it.
Yep.
And if you're presented with a problem, you might not be able to solve that problem as effectively. What's one of the worst things for sleep? Go to bed really, really stressed.
Yeah.
Sleep is number one to health, in my opinion, and it's one of the best protective factors for executive function. So, though, just learning how to manage stress more effectively.
Okay.
I think another thing would be is to really have an appreciation for the interconnectedness between poor sleep and executive function, because you will find plenty of research literature that talks about executive function impairments are going to be more common among people with insomnia,
Hmm.
obstructive sleep apnea, restless leg syndrome, even just general snoring. So the takeaway point here is be mindful of your sleep health. If you're one that wakes up every day, you're exhausted no matter what. You're
Mm-hmm.
waking up several times a night. There's no harm in talking to your healthcare provider. There's no harm in getting a sleep study.
Mm-hmm.
Many people have sleep apnea. They don't even realize it. And you don't have to be overweight to have sleep apnea. I know many people with sleep apnea who are very skinny, inactive. I know one person with sleep apnea who went to their dentist. Their dentist said, "Did you suck your thumb as a kid?" And the person said, "Yeah, sure enough.
Mm-hmm.
Looks like the bridge of your mouth is kind of not formed properly." And that would be something to consider getting tested for sleep apnea. Sure
Hmm.
enough, the person had sleep apnea. And it was just from the way their teeth formed and the bridge of their mouth formed.
Uh-huh.
So just there's so many things we don't think
Hmm.
about there, that just little tips along the way that I've learned. Circadian rhythm misalignment is a big factor to
Mm-hmm.
consider too. So if you are one that, again, stays up all night, sleeps all day, you're pounding down the caffeine, you get up in the morning, but you get right to work and you work in a basement, you're not getting any natural sunlight, that circadian rhythm misalignment could be a factor in your cognitive brain health too.
Mm-hmm.
Really pay attention to what you eat. Again, I'm not giving medical advice here, but if you're one to eat fast food every day and processed foods and you skip meals and you have lots of sugar sweetened beverages, we know that's not good for our physical health, but it's not good for brain health as well. So really put a premium on what you put into your body in terms of food. And
Mm-hmm.
again, I'm not telling you what to eat or anything, but look at the research on the Western diet versus the Mediterranean diet. You will
Mm-hmm.
find so many studies that show that the Mediterranean diet is really good for brain health. Great research out there on that as well. So if you're one that doesn't seem to exercise much, that can have an impact on executive function. If you're one that deals with a lot of social loneliness, isolation, that is very, very bad for brain health as well. So there's a lot of things we can do here.
Mm-hmm.
Do it in community, educate yourself about these kind of things. Maybe work with a therapist or counselor who understands these things too.
Yeah. So a lot of lifestyle adjustments. So
Yeah,
we should put our make some conscious effort to lower stress. Definitely look at our sleep habits, make improvements there, diet, exercise, and then socialization. So all of these things, I think, if people are are struggling with, you know, pick one aspect of those and say, okay, what's the next step I can take in improving this? So like sleep, one thing is if you need blackout curtains, if you need, definitely put a halt to screen time at 30, 60 minutes before you go to bed. Even just those little adjustments can, over even a lot of times a short period, like even within a couple of weeks, can make a huge difference. So yeah, okay, great. That's definitely some good stuff. And one last one, unless you have something additional, would be what some pointers for people in the professional field in terms of doctors, therapists, coaches, nutritionists, to maybe some things that they could look for, or directions they could steer clients in.
I think if you were to get training in lifestyle medicine, that would cover most of these interventions we're talking about. I have
Okay.
a certification in lifestyle medicine. Basically, what that is, there's 6 pillars of lifestyle medicine. It's very common sense, but it's putting a premium on positive social connection.
Mhm.
So helping clients get connected to positive people, reducing isolation, loneliness. Maybe it's teaching friendship making skills and those kind of things. Staying away from harmful chemicals. Most people think drugs and alcohol, but I would probably extend that to if someone has a sugar addiction or they're just pounding down the salty foods. So
Mhm.
looking at other addictive tendencies, and it could be a behavioral addiction too, a screen time addiction, because you kind of alluded to this. If you're on the screen all day long and right up till bedtime, that impacts your brain health, that impacts your sleep health. Lifestyle medicine also relates to capitalizing and optimizing sleep, exercise, and diet.
Mhm.
Lifestyle medicine would be a great thing. I think another complement to lifestyle medicine that clinicians, providers might want to look into is something called therapeutic lifestyle changes. Very similar to lifestyle medicine, but therapeutic lifestyle changes also look at screen time. It looks at reducing materialism, helping clients maybe get a volunteer job, getting outside of themselves. So, therapeutic lifestyle changes and lifestyle medicine, 2 great approaches I would recommend learning more about.
Yeah, that's awesome. I I've had this discussion with all of my friends, even the ones that didn't want to have the discussion. I enjoy talking about it, but a lot of professionals as well. How interesting it is that historically, we've kind of gone through the Industrial Revolution and then into a a large leap in technology and medicine. And now we're kind of, at least in the past decade, maybe 2 decades, we're kind of going back in a circle back to what people had in their lives before all of the industrial and scientific advancements. And just what you're talking about, lifestyle, how effective that is in normalizing your health, mental health, physical health, and those things um, that are just the basics, diet, exercise, and healthy socialization. So that's all. That's just fascinating to me. I
Have
think
you studied the blue zones? Have you heard of that?
the blue zones. No.
So there's documentaries on this, there's websites, there's articles. So it's the regions around the world where people live the longest. Like there's highest
Oh,
concentration of people,
yes,
100.
yes,
And studying the blue zones within the context of lifestyle medicine, it's just common sense, getting up and moving more and laughing, being around people, having life purpose, good meals. I mean, just
yep,
doing things more naturally. And
yep. Places like Japan and Greece,
yep.
and where and and it makes the connection, actually hits home to our point in that the stuff I've read on that, it's not just the physical health, but you're talking about people in their 90s, between 90 and 100 to 110, who are still very mentally sharp.
Oh
you
yeah.
know can have a normal discussion. Like if you talk to this person on the phone, you probably would never know what their age was. They're still very engaged, and it has to do with exactly what you said: healthy lifestyle in terms of diet, exercise, um, behaviors that are not self-destructive, limiting those. So yeah, that's a awesome. Very cool. All right, so thank you, Dr. Brown, again for remarkable insight. This is, I think, probably one of the most important, or I would say the most applicable of the things that we can look at individually and then as professionals as well, is, the lifestyle habits, the physical health, and how it affects mental health and vice versa. So great topic, great topic. All right, everyone, join us next time for part 4 of this amazing 6-part series on executive functioning, where we'll discuss, we'll look at this from a neuroscience perspective. So that should be very interesting. You can find a list of each episode in the description. And as always, please subscribe, like, comment, and please share with people that you think would be interested in these topics. And that way we can all stay connected to this community of mental well-being, where we all learn and grow together. Thank you, Dr. Brown.
Thank you, Jamie. Appreciate it.